Hey, everybody, this is Dr. Osborne, founder of the Gluten Free Society. Today, I want to talk a little bit about how do you know whether the gluten free diet is right for you. In essence, if you are entertaining maybe going gluten free, how do you know? How do you know it's the right move to make? How do you know that changing your diet to such a level is a smart move for you? And so, what I've got here is a diagram on gluten sensitivity. Now, I have an interactive quiz. If you'd like to take that, I'll put a link in below this video. But this diagram, basically what we're looking at are a number of the different symptoms that are associated with gluten sensitivity. And you can see they're categorically broken down for you. So you can see hormonal symptoms, fatigue, inability to lose weight, difficulty falling asleep, infertility, unexplainable infertility, very big symptom of gluten sensitivity. So if you've got a history where the doctors have said, we don't know why you can't get pregnant, but you can't, oftentimes gluten is part of the underlying reason as to why that can happen. Thyroid disease, Hashimoto's, hypothyroidism, hyperprolactinemia is another big one. A lot of research showing that gluten sensitivity can actually trigger that. And then type 1 and type 2 diabetes, hypoglycemia, PCOS, endometriosis. So these are different hormonal patterns where oftentimes people who develop these hormonal patterns are actually developing those patterns because they're gluten sensitive. Now, if we come over here and we look at the head and the nervous system, and you're going to see certain things in red and certain things in black. If you see the things, if you're experiencing the symptoms in red, there's a much stronger likelihood that you have a gluten issue. Again, this is based on symptoms, not based on testing. If you want to get tested, the best way to discern it is genetic testing. And I'll put a link to that below this video as well so you can learn more about genetic testing. But again, if you're just trying to map out whether or not the gluten-free diet is right for you and you're just trying to maybe go do a trial diet, if you experience any of these symptoms in red, there's a strong likelihood that yes, going gluten-free will most likely be very beneficial for you. But even the symptoms in black, the headaches, the sinus congestion, poor memory, word recall problems. So, trying to bring a word to your lips and you know the word, but you can't think of what to say, that's difficulty recalling words. If you suffer with vertigo or imbalance, if you have been diagnosed with chronic fatigue syndrome or multiple sclerosis or Parkinson's, there's now some new research coming out on gluten being a neurotoxin and that neuropathy, so numbness, tingling, pain in the hands. There's a condition called reflex sympathetic dystrophy that gluten-free diets have been very helpful in. And so again, you can see a lot of different nervous system symptoms that have been linked in the medical research to gluten. We also have a number of skin problems. So fever, blisters, mouth ulcers, skin rash. As a matter of fact, a colleague of mine did a study randomly asking the question, what's the number one symptom for those who are gluten sensitive? What's the number one symptom they report? And that his research showed that fever, blisters, or mouth ulcers were the number one symptom that people with known gluten sensitivity reported. So fever, blisters, mouth ulcers, big one to look out for if you're experiencing that. A lot of times doctors will tell you it's a virus, but if you have them repetitively and you're not picking up the cold or the flu or anything else, it can be from gluten sensitivity. So eczema, psoriasis, there's a condition called dermatitis herpetiformis, which is an autoimmune condition of the skin linked to celiac disease, and then vitiligo. So all forms of skin problems. Then we have immune system problems, chronic urinary tract infections, chronic respiratory infections. So if you're chronically getting the cold in your chest, there's a good chance that taking your diet gluten-free might be very helpful. Asthma is a big one. There's actually one of the original terms for gluten sensitivity is called baker's asthma because bakers would pick up asthma as they were inhaling the flour as they were baking it. And then common chronic yeast infections, whether that's vaginal in females, oral in the mouth like thrush, or nail bed yeast infections. So if you've got like a yellow discoloration under your skin, that is also a sign of poor immune function that could be caused as a result of gluten. And then muscle and joint problems. A lot of people have muscle and joint problems. I wrote a book called No Grain, No Pain. It was published by Simon & Schuster and talked all about the connection between rheumatological disease, things like rheumatoid arthritis, lupus, autoimmune arthritis, right, as a link to gluten sensitivity, meaning that people with gluten issues, cutting gluten out of the diet oftentimes leads to a complete remission of the autoimmune problem. So if you suffer with an autoimmune rheumatology disorder, as the ones you see listed here on this side in red, the fibromyalgia, the RA, the lupus, the reactive arthritis, AS, those different things. Again, very, very important that you consider going gluten-free. And we also see, interestingly enough, something called migrating joint pain, which is pain that radiates, but it moves around, so it goes from one area of the body to the next, and that it's oftentimes referred to as migratory pain. So if you're experiencing that and there's no injury, there's no trauma, that's a good sign you need to go gluten-free. And then we have gut symptoms, craving sweets, high sugar foods, intestinal bloating or gas, especially after you eat, so IBS, irritable bowel syndrome. If you suffer with acid reflux, there have been a number of studies that have linked gluten to Barrett's esophagitis, which is a form of severe erosional damage of your esophagus, as well as something called inflammation in the stomach, in the lining of the stomach. There are a number of conditions where when you have a scope done, that where a doctor will say, yes, you have some inflammation in your stomach, but it's no big deal. There have been a number of research studies that show that even that low level of inflammation being shown in the stomach on a scope, it can actually be linked to gluten sensitivity. And then indigestion, constipation, diarrhea is a big one, but it's not so common. Like a lot of people don't experience diarrhea as a result of gluten exposure unless they have celiac disease. Other internal diseases or problems that have been linked to gluten, two big ones here: autoimmune hepatitis and lymphoma, and lymphoma being a form of cancer, so possibly a very terminal disorder. So if you've been diagnosed with lymphoma, I highly encourage you to investigate whether or not going gluten-free is playing a role, or not being gluten-free is playing a role in that. And then gallbladder disease, gallbladder inflammation, elevated liver enzymes. So if you go to the doctor every year, you get your checkup, and everything's normal except your liver enzymes are a little elevated, that can be a sign of gluten sensitivity. So understand that, what I'm trying to do is give you an idea of a number of the different medical problems, symptoms, signs that have been linked to gluten sensitivity in the medical literature, in the research, and that understanding that gluten is not a trend. Like the diet itself it's not a trend. A lot of people look at it as this fad or trend, but it's not a fad, it's not a trend. And not going gluten-free when you need to go gluten-free can be very, very dangerous. It actually can be threatening to your life. Now, again, if you want to go take a simple online quiz, I'm going to put the link to that quiz below this video. You can go check it out. And if your quiz comes back positive, there's a very strong likelihood that you're gluten sensitive and that you may want to just change your diet. Now, if you're more of I need black and white proof, that genetic testing is what needs to happen. A lot of doctors will run antibody tests, or they'll do a scope to see if you have celiac disease, but those tests are not super specific for non-celiac gluten sensitivity, which is what most people who react to gluten have. Actually, celiac disease is quite rare versus non-celiac gluten sensitivity. So you can have a gluten issue and not have celiac disease. And if you go to the doctor to have celiac tests run, those tests can be very misleading. So genetic testing, if you really are on the fence and you really need the data to justify making the diet change, I highly recommend that. Hopefully this is helpful for you in navigating whether or not a gluten-free diet is right for you. This is Dr. Osborne, founder of Gluten Free Society. Have a fantastic day.